Think that you might have chlamydia, or have you recently received this diagnosis? Stay tuned as we will be talking about the 5 most common symptoms both men and women with chlamydia experience. Welcome to JHP Medical. I'm Dr. Hart-Pinto. I'm going to tell you the 5 most common symptoms of chlamydia and a few important tips. If you like this video, remember to subscribe and click the notification bell so you don't miss out on any of our most up-to-date videos. So what is chlamydia? Chlamydia is one of the most common sexually transmitted infections in the UK. Chlamydia trachomatis is the bacteria that causes chlamydia and spreads through unprotected vaginal, oral or anal sex. If left untreated, chlamydia can cause serious problems for both men and women. Amongst men, the infection can spread to the testicles, causing pain and swelling. For women, the infection can progress to pelvic inflammatory disease. This can lead to persistent abdominal pain and long-term fertility issues, meaning that you may have difficulty getting pregnant in the future. Fortunately, these complications can be avoided where infections are identified and treated early. Symptoms of chlamydia normally develop within a few weeks of unprotected sexual intercourse. The top 5 symptoms of chlamydia experienced by women are pain when passing urine, unusual vaginal discharge, pain during sex, bleeding between periods or after sex, pain in the lower abdomen or pelvis. Men can also experience symptoms of chlamydia infection. Amongst men, the top symptoms experienced are pain on passing urine, unusual discharge from the tip of the penis, testicular pain, urethral itching, or a burning sensation. Of course, depending on the type of intercourse you've experienced, the symptoms may present at other areas. You may experience discomfort or unusual discharge from your back passage where you've engaged in anal intercourse. If you've engaged in oral intercourse and developed a resulting chlamydia infection of your throat, you may also experience symptoms of a sore throat. However, most important is that chlamydia doesn't always cause symptoms if you have the infection. At least 70% of women and 50% of men infected with chlamydia are asymptomatic, meaning they don't display any symptoms. So if you're concerned you may have a sexually transmitted infection such as chlamydia, you should seek a test from your doctor or GUM clinic. You may be thinking, should I get a test? If you're experiencing any of the symptoms above, or believe you may have been exposed to someone who may have chlamydia, you should get tested. Testing for chlamydia is painless, quick and easy. Your doctor may choose to obtain either a swab of the discharge from your penis, vagina, bum or throat, or a urine sample. The results of these tests usually take about 7 to 10 days to come back, and you'll know at that point whether you have a positive or a negative test. In England, it's currently recommended that all sexually active people under the age of 25 receive annual testing under the National Chlamydia Screening Program. Testing should also take place if you change your sexual partner. So when will I receive any treatment? If you have symptoms and signs strongly suggestive of chlamydia, your doctor may commence treatment at the first consultation. Otherwise, you'll only receive the treatment after you receive a positive test. So what treatment will I need? You'll be glad to know that chlamydia infections are easily treatable. If your doctor identifies that you are one of the people who require treatment, they will prescribe you a course of antibiotics. Currently, in the UK, the antibiotic of choice is doxycycline, taken twice a day for 7 days. However, this may be different depending on where you live, and the antibiotic guidance nationally changes regularly. So the antibiotics that you receive may be different. It doesn't mean they're wrong. One really important point is that you must complete the entire course of the antibiotics, even if you start feeling better. So what about my partner? Do they need to be treated too? It's important to recognise that once treated, you can still be reinfected. Therefore, it's important that your partner receives the same treatment also. It is recommended that you should avoid sex for about a week from the start of your treatment and until 1 week after your sexual contacts have been treated. If you have multiple sexual contacts, it's important to engage with contact tracing. as without treatment, other people may become infected and they can have long-term complications which can have a significant impact on their quality of life, something nobody wants. Your local GUM clinic can assist you with this. So I've had chlamydia. How can I prevent getting it again? So there's one simple way of reducing your risk of contracting chlamydia again in the future. Where possible, you should try to use barrier contraceptives, like the condom. So thank you for watching. We hope you found this information useful. If you've enjoyed this video, why not subscribe, click the bell, or write a comment down below. Of course, this video does not provide individual medical advice and is intended for information purposes only. Please do not consider this as a substitute for medical advice, diagnosis, or treatment. Please don't ignore any professional medical advice you receive in seeking treatment because of something you've heard here. If you believe you have a medical emergency, immediately call your doctor or ambulance service. Thank you for watching. See you next time.